Assalamualaikum. How are you? My name is Man. I'm a pharmacist. Recently, I found that people are searching for COVID depression or coronavirus depression. Uh, Here, I want to tell you that it is not always the depression that the people may face, as it could also be a stressful situation that they may confuse with depression. For instance, depression has certain symptoms, as also noted by American Psychiatric Association in DSM-5. In a previous video titled "What is depression?" or "Depression kya hai" in Urdu, I told about the signs and symptoms. There are 9 signs and symptoms associated with depression that may also be found in COVID depression, and 5 of these signs and symptoms have to be found in the patient for the last 2 weeks. And in only in this situation it could be considered as depression. These signs and symptoms that I told in the video may include depressed mood, decreased interest in activities of daily life. These are two critical signs and symptoms that have to be found in the patient. Among the other symptoms are weight loss or weight gain, insomnia or hypersomnia, that is lack of sleep or extra level of sleep, psychomotor agitation or retardation, that is abnormal type of activities, fatigue or loss of energy, feelings of worthlessness or guilt, diminished ability to think or concentrate, and eventually there are thoughts of suicide or attempt of suicide. If a person has these symptoms, 5 of these symptoms during this COVID-19 pandemic or coronavirus pandemic, then it could be considered as the patient has COVID depression or coronavirus depression. In this situation, it is better for the patient to go to a psychotherapist, as he or she may prescribe antidepressants that are considered as best treatments for depression, or he or she may also start some psychotherapeutic techniques. Here I have found some science-backed techniques that could help in dealing with depression, COVID depression or coronavirus depression. These science-backed techniques may include sport and physical activity, as could help in alleviating depression. It has been found by researchers from University of Bern and published in 2014. Another interesting thing that I have recently found is that the researchers published in the Journal of Neurology, Neurosurgery and Psychiatry, that is affiliated with BMJ. They found that anti-inflammatory agents can effectively and safely curb major depressive symptoms. Simple treatment: anti-inflammatory agents such as paracetamol or aspirin, they could help in dealing with depression, but don't take medicine without prescription of your doctor. These are over-the-counter medicines, but it is better to take medicines only after the prescription of your doctor. Another evidence-based treatment that I have found is that of the use of fish oil that could help in dealing with depression. Its research was conducted by the researchers from University of Illinois at Chicago and was published in the Journal of Molecular Psychiatry in 2020, this year 2020. So, sports and physical activity, anti-inflammatory agents such as paracetamol and fish oil could help in dealing with depression. If a person has certain signs and symptoms of depression during this COVID pandemic. Otherwise, in most of the cases, it is not depression, it is only a stressful situation that a person is facing, is experiencing. Uh, in this regard, I want also to tell an article published by Richard I. Shader in the Journal of Clinical Therapeutics, April 27, 2020. According to this article, depression and demoralization are different things that a person may face during this COVID-19 pandemic. In case of depression, it is often difficult to lift the spirit of the person who has been depressed. Even a good news could not help in improving the condition of the patient. He could not be supported. It is difficult to improve the spirit of that person or increase the level of energy of that person. Whereas in demoralization, which could also be considered as the consequences of defeat stress, as I told, there's a stressful situation that people are usually facing in COVID-19 pandemic. So demoralization, a person could be supported, could be spirited, could be helped. His counseling could help in him in getting out of that situation, that stressful situation. Counseling, psychotherapeutic counseling could help him, her easily. It could be demoralization, not depression, that people may face in COVID-19 pandemic. In case of stressful situation, I think I have to tell you the advices presented by the Centers for Disease Control and Prevention in the US. These advices may include: know what to do if you are sick or concerned about COVID-19, know where and how to get treatment, take care of your emotional health, take breaks from watching, reading, or listening to news stories. This is the most important thing. Move away from the news stories, at they could increase your stress level. Take care of your body, exercise regularly, get plenty of sleep, avoid excessive alcohol or drug use, take well balanced meals, make time to unwind or do the activities that you would like the most, connect with others, and share your feelings with other people. So, these could be the interventions for stress, and they are presented by the Centers for Disease Control and Prevention, CDC, in the US, on their website. So this is about depression and stress that people usually experience in COVID-19 pandemic, and they often mistakenly consider stressful situation with the depression, COVID depression. So it is better to study what is depression, what is demoralization, and stressful situation, and deal with the condition accordingly. In the last, let me say that you can also support my work on Patreon, so that I may keep on posting such informative videos for you. Thank you.